Hello, welcome to the Distinct OT channel. Today I'll be talking about cerebral palsy. Cerebral palsy is caused by abnormal brain development or damage to the developing brain that causes a group of disorders that can affect movement, posture, learning, hearing, seeing, swallowing, and thinking. The signs of cerebral palsy usually appear in the first few months of life, but many children are not diagnosed until age 2 or later. In general, early signs of cerebral palsy include some developmental delays. The child is slow to reach milestones such as rolling over, sitting, crawling, and walking. Developmental delays are the main cues that a child might have cerebral palsy. I posted 2 videos on my YouTube channel about developmental milestones and developmental delay, so you can go and click the link below this particular video to watch and learn. Also, click the thumbs up, leave a comment or ask any question in the comment section, and don't forget to share with your loved ones. Damage to the brain can happen before, that is prenatal, during, perinatal, or shortly after birth, postnatal, when the brain is still developing. The prenatal causes are maternal diseases, trauma, genetic factors, medications, bleeding, and then the perinatal causes are premature or delayed birth, inappropriate birth position, low or high birth weight, cord entanglement, oxygen deprivation, multiple gestation, difficult birth, and birth trauma. The postnatal causes are febrile diseases, for example meningitis, trauma, hyperbilirubinemia, hypoglycemia, in an intracranial hemorrhage. Symptoms vary from mild to serious. The effect on function vary from person to person. Some people with cerebral palsy can walk, while others need help or assistance. Some have intellectual disabilities, but others do not. Now I'll be talking about the general symptoms. The general symptoms include trouble with movement and coordinations, speech and eating, and under speech development, delays in speech development, we have trouble speaking, trouble with sucking, chewing or eating, drooling or trouble with swallowing. Other delays include delays in reaching motor skills milestones such as sitting up or crawling, learning disabilities, intellectual disabilities, delayed growth resulting in smaller size than would be expected, and some children have symptoms such as seizures, which are symptoms of epilepsy, and trouble with hearing and vision, pain or trouble feeling sensations such as touch, bladder and bowel issues such as constipation and urinary incontinence. Basically, there are several types of cerebral palsy. They include the first one, spastic cerebral palsy. This is the most common type of cerebral palsy. It can lead to high muscle tone, jerky movements, joint stiffness, muscle tightness. This type of cerebral palsy causes walking abnormalities such as making scissors-like movements. The second type of cerebral palsy I'll be talking about is the dyskinetic or athetoid cerebral palsy. It causes involuntary movements in the face, limbs, and trunk. Children with this kind of cerebral palsy have problem controlling movements. It causes floppiness in the limbs, problem with posture. It can also make some children to drool. The third type of cerebral palsy is ataxic cerebral palsy. It affects balance, coordination, depth perception, and posture control. It causes tremors, poor coordination, speech difficulties, and spreading of legs apart while walking. The fourth type of cerebral palsy I'll be talking about is hypotonic cerebral palsy. It is classified by low muscle tone that causes floppiness of muscles. It can cause poor head control, walking abnormalities, and it may cause breathing difficulty. And then we have mixed cerebral palsy. Some children have more than one form of cerebral palsy. The most common type of mixed is spastic dyskinetic cerebral palsy. Cerebral palsy affects lots of functions. Occupational therapists provide interventions depending on the age, functions affected, and severity of the conditions. Occupational therapists would assess the condition and provide individualized treatment plan. They address difficulties in performing the daily skills and activities depending on the age, such as neck control, sitting, crawling, feeding, bathing, dressing, writing, learning, and so many others. Sometimes assistive devices and aids are recommended and provided to enable a person with cerebral palsy live independently. If you discover that your child or someone you know has exhibited some of these symptoms, it's best to see a health professional as soon as possible. Like I used to say, remember, early intervention leads to better outcomes or results. Make sure you see an occupational therapist as soon as possible. To watch more educative videos from this channel, make sure you subscribe, click the thumbs up button, leave a comment or ask your questions, and don't forget to share with your loved ones. Bye.